Hi, I'm Anastasia, America's dental hygienist and editor for Modern Hygienist. This week, we placed a post based on the labor, the Bureau of Labor Statistics, and it gave an average of dentists, hygienists, and dental assistants, what our average wage was and what our average income was. And let's just say it created quite a buzz in our industry. It was a deflation debate, and I am not talking about the Super Bowl here. So, you know what? Let's just take this week's editor's note, which we do have in print in this one, little video for you. But instead of complaining and looking at, wow, these are deflated, these are too low, what are we gonna do? Blah, blah, blah. Has that gotten us anywhere? Does it get anybody anywhere? And if it does, I'm sure it's not really that far. So let's look at it this way. Complaining is draining. Write that down. That should totally be in all of our practices because it really is not, you can't flourish in that. So let's go from a solution approach, okay? I'm gonna put up here different areas that we can bring value to a practice. We can bring value to the dental office and our patients. And when you bring value, you bring worth. So yes, I'm gonna ask you, what do you bring to the table? What's your mindset? And let's look at different areas across the United States that you may want to amp up your professional development. Take ownership and leadership of what you get to do and then bring it to that practice. So let's just review a couple of things here. So what if you could fully integrate? And I'm talking fully, not just like we're going to perio chart once a year and that's great, but I mean fully integrate periodontal programs. Get technology for oral cancer. I know we're doing oral cancer screenings visually, but what if you added technology? That would be another plus. So assisted hygiene protocols, yes, they do work. I've practiced them. They absolutely work, and I loved it. It was the best way to practice dental hygiene. Nutritional counseling, bruxism, sleep apnea, ortho, if your doctor goes into that, oral hygiene instructions, spend more time doing that and show how patients can value that, and so can the practice. Caries risk assessments and protocols. Do your patients even know what risk they're at? Low, medium, or high risk for caries? Lasers, if it's in your state, go get certified. If you get the opportunity to be, to have and place local anesthesia, then do it, obviously. Okay, frenectomies, tongue ties. If you've got a practice that works with lactation consultants, you can do this. It's an awesome service. Many women don't even know, and obviously it affects your speech later on. So doing something like that, myofascial therapy, very, very big. Migraines, TMJ therapy. Get into that too. This brings value to what you do as a professional, and it's all within our scope of practice. And then obviously, finally, it's communication with your patients. And that means, what if you united the medical profession with the dental profession based on that patient's health history, at least going along with the oral systemic health connection? So take your diabetes patient, let's get on their team, with endocrinologists. Or what if you had somebody with heart disease? Why don't we connect with that? When you add value, you add worth. I welcome anything else we can add in the profession so we can bring it to the table. Now, let's say you do that, I get it, and you say, you know what? Average isn't working for me anymore, Anastasia. I've done this, I've brought my value, and it's not going to happen. Then I encourage you, we've got friends at Dental Post. Check them out. They just integrated all new. It's a matchmaking service in our profession. So what they do is they will look at, the employers will check out office culture and skill sets that you bring to the practice, so they nurture better dental teams, and that only flows into better treatment for our patients. So that might be a service for you if you outgrow what average is. So really, I guess that's pretty much the question. How good, when is good enough, or is average good enough? So I encourage you to go beyond average, because we can in this profession, and add more value to what you do, which obviously increases your worth. So you've got a question and you just want to do, Google Hangout and share how you can add value, and that obviously adds more to your salary and hygiene, then let's do a Google Hangout. Connect with me at Modern Hygienist. Otherwise, till next week, take what you learn and make a difference with it.